Number 49 query from Lucknow, Uttar Pradesh. Sir, I'm practicing since December 2021, but I'm not able to fix the charges. I am an endodontist giving my 110% for 1 RCT, and in return, I'm not able to charge properly. I have good OPD, but patients won't turn up after knowing the charges. I'm visiting some clinics for consultation. They pay me 1,700 to 2,000. I feel going to other clinics and getting this much. Rather, I can keep this much for RCT at my clinic so that I will have my own patients. But I don't feel good from inside if I charge less than 3,000 for RCT. Should I keep fluctuating I keep fluctuating my charges? So let me come to that. So the question is, if you are having a good OPD and the conversion ratio is not good, you need to work on your selling skill set. We sometimes sell things by default. When you are selling by design, selling by, you can say in a proper way, you need to understand 3 pertinent questions. Why buy this? Why buy from me? And why buy now? Unless you have answers to these 3 questions, what are your competitive advantages? What are your strengths in this? You are not going to get a solution to this. You have to sell by a script. Make your script. Why buy this? Why a endo treatment is good for the patient. Saving the tooth, everything, blah, blah, blah is fine. Add a few more components to it. Why buy from me? What is your competitive advantage? An MDS is 1. Specialist is 1. What are other advantages? What are your strengths? Why buy now? Creating an emergency in that. If you work on that, you're going to get a good convergence here. You have not mentioned your conversion here, so I believe it should be less than 50% as you are saying. But having understood that, you need to clearly demarcate between what exactly is a good conversion ratio. It is 72 out of 100. So if 100 patients walking through your door and 72 are converting, you're actually doing good. Not everyone walking through your door is your patient. So understand that part very, very clearly. You are never going to get 100 out of 100 conversions. You may be getting 80, some may be getting 80 to 90. It's, you can say, very nice, out of the world. But I would be very happy with just 72 as well, because that is the ideal conversion ratio. But if not below 45 to 50, I would expect. If you're getting that, the clear-cut thing is you need to know what exactly is your number. So charging 1,700 to 2,000 is, again, if you're going as a consultant, 1,700 to 200, 2,000 is a very less. And Lucknow is not a tier 2 city. It is a tier 1 city. Maybe 1.5 you can say, but it is still tier 1 city of Uttar Pradesh. So you have those charges as your benchmark baseline, I would say, on the lower side. A tier 1 needs to work out his costing first. Of course, any tier of city would need to work out their costing, but tier 1 needs to work more on that because the overheads are high compared to a tier 2 and tier 3. Tier 2, tier 3 में थोड़ा बहुत overhead चल जाता है because the volume is there. In tier 1, the volume is not always there because there is more of urbanization and more of patients in that sphere. So you need to work out first what is your costing and then set your boundary price. A boundary price is a negotiable price, for example, as they say in sales. That is the price you're willing to go up to. The question is, are you willing to give that discount? The problem is not in giving the discount. The problem is giving it to wrong people. Which brings me to your second query. Charging my relatives. We all need to have a clinic policy, which can be 5%, 10%, 15%, 20%. That is my way. I still say 5% discount is hardly a category. So keep your policy between 10, 15, and 20 for 3 categories of patients. One would be relatives. One would be friends. Again, friends can be good friends, okay type friends, or decent type friends, or acquaintances, or friend ka friend, like that. So very good friends can be kept in the relative category, friends, and then medical professionals. According to your clinic policy, 10, 15, and 20. That is my suggestion. You can go 30, you can go 5, it is your choice. You can go 0 also. It is your choice. I'm not saying give it to everyone. I'm saying it to give to these 3 category of patients. But inform prior. Inform prior. Unless you do that, you are in the wrong place. That if you don't inform prior and pe bolo itna to lagta hai and all those things. Having said that, consent solves most of the problems for us in that regard. A treatment approval form also solves many of the problems where we inform the patient and where the patient knows actually that the problem does not lie in me or problem lies in understanding the situation. So the third pain point is my friends who are working in government sector, not practicing in private clinic, they have any relatives to refer, they're asking for charges. They know we have expenses with profit. So if I'm charging more than expenses, they feel you are getting profit from us also. So how to handle such things? The simplest one-line answer I can say is put it on Dr. Bhavdeep Ahuja. I saw Dr. Bhavdeep Ahuja's videos. I learned how to calculate the costing, direct plus indirect. This is my landing cost. This is the system I use. This is my landing cost. Now, there are 2 aspects in this. Number 1, somebody understands root canal cost you have, root canal treatment pricing you have kept at 3,000. इसमें तो यार 800 रुपए 1000 रुपए का सामान लगा, तो तुम मेरे रिलेटिव से 1200 ले लो 1500 ले लो, इससे ज्यादा मत लेना. That your pricing is 3,000, your costing is 800 to 1,000 as per the common notion. So charge 1,200 or max 1,500. Don't loot my relative is the common concept, common you can say mindset. If you put it on Dr. Bhavdeep Ahuja, as I said, and calculate the real costing, what is being charged to you, you can very well decide these are my charges, direct plus indirect. I can't go below this price. And you will be shocked. Your price for a root canal will come above 1,500 to 1,700 that you mentioned in the previous question. It will surely be above 2,000. And when I talk of the costing, I talk of direct plus indirect, not only the material cost. I take the cost of CSA also in that, chairside assistant in that. I take the other costings which are applicable to us. And then I arrive at a number. It is very simple to say a clear-cut no before the start. Not legally speaking, but otherwise also speaking, you are in a dominant position before the start to say a no. दोस्ती में व्यापार mix नहीं करते. It's a common thing. You don't mix friendship with business. Be very clear cut. दोस्ती अपनी जगह, हिसाब अपनी जगह. पंजाब में एक कहावत है, मुहावरा है. I'll translate it for you. हिसाब माती इधर. That there is a transaction between a mother and a daughter also. There can't be a closer relationship than that. If my mother had spent something for me after marriage, it is my prerogative to pay her. Whether she wants to get it from me or not, that is one thing. So I'm just loosely translating it for you. So that means there should be not mixing of friendship and business. You are in a dominant position to say a no before the start. Why can't you do that? If you know the thing is costing you, let's suppose 10 rupees, and the friend is telling you, boss, it is the cost 5 rupees. So you can charge decent profit, charge 6 rupees also. No, my landing cost is 10 rupees. I'm charging 20 rupees from patients. What I can best do for you is charge 15 rupees from your patient. Why I gave the example of 10 and 20? Because I believe your net profit margin should be 50%, 50, which means your all costing included, direct and indirect, should be half of your selling price. Bare minimum. Boundary price for me is 45%. ठीक है, 19 रुपए चार्ज कर लो, close to 40, you can say 45% net margin. 90 minus 10, 90 is my 45% net margin. So that is what I'll be looking at. Not that my costing, I look at direct charging, 5 rupees is my direct costing, so I charge 10 rupees or 7 rupees or 8 rupees. You are not even meeting the actual cost by charging 7, 8 or 10. So don't fall into that trap. You are in a dominant zone to say a no at the start. Say it. Put it on Dr. Bhavdeep Bhoj, as I've told you. Easy way out. मैंने उनके वीडियो देखे, तुम भी देखो, तुम्हें भी आइडिया लगेगा कि कॉस्टिंग कैसे होती है.